everyone, I'm Nidhi and I'm a first year medical student from GMC Aurangabad. So today on popular demand we have with us Dr. Aheli Bal. So basically Dr. Aheli Bal is a resident doctor and she's currently doing her PG in pathology from AIIMS Bhubaneswar, and she has done her MBBS from JIPMER Pondicherry. So how is MBBS in JIPMER different as compared to that in normal GMCs?
First is the batch strength. Like in JIPMER, we have 150 students, and mostly like I had friends in Calcutta Medical College and other colleges in Calcutta. So their batch strength was much more, like 250 and 200 per batch. So I think one is the batch strength, so which means the student to teacher ratio was better. Like for instance, when we were in dissection hall, we were 10 students and one SR, like 10 people, one cadaver and one SR. So there was no crowding, like we were not jumping on each other to, have a view at what is going on. And other than that, I think clinical exposure will be good in most colleges. Like, people say that if you are from JIPMER and AIIMS, you have more clinical exposure. But I think any good college in the country will give you that exposure. It need not just be, AIIMS and JIPMER. And other than that, well, in JIPMER, we have something called computer-assisted learning. This is not something I've heard of in other places.
Since you're done with MBBS, what is the best advice you have for juniors like me who are currently studying in med school?
So basically, MBBS, you should, apart from studies, which I feel I should tell every junior of mine, you should also enjoy your life. MBBS probably is the last stage of your life when you can really enjoy. Like, once you're into MD, you have a lot of responsibilities. You're releasing reports, you're seeing patients, everything independently. But as an undergrad student, you are not doing anything independently. You always have your residents and your SRs and seniors. You are just learning. So you're allowed to make mistakes at that stage. So academics are tough. Obviously, MBBS is a very vast course, but just don't let that get into your head. Like I spent a great deal of my time during UG worrying about exams. Like JIPMER is famous for exams. Every other week on Monday, we would have one exam. Like literally half the month we were giving exams. So I would really stress out about them, about the exams, and spend a great deal of time thinking what would happen if one exam goes bad. But now when I look back, I think it doesn't really matter what I scored in one particular exam of JIPMER. Like it does not have any long-term implications. So along with your studies, do take time for your hobbies and like enjoy life.
So if you could go back in time, then what mistakes would you avoid during your MBBS?
MBBS years. So when I was in second year and we first started medicine classes, so there was this huge hype about Harrison. Everybody was buying Harrison. I think that time it was the 18th edition of Harrison. So all of us would run to the bookstore and buy those 2 huge volumes of Harrison. And I bought it in my second year itself. I was just in my third sem and I had bought both the volumes of Harrison and I was just sitting with them. I'm going to sit and finish it all in this semester. It was, I had that whole thing. And gradually I realized you cannot sit and, finish Harrison. Like I was trying to do that whole of my third sem and then again in fourth sem that I should sit and finish Harrison. So I think if I could go back in time, I would take that time out and do something else. I wouldn't, spend so much time trying to mug up Harrison because practically it is not feasible. And much later when I was preparing for my entrances, I realized there's this one tiny book of Harrison. It's called some manual of Harrison, I think. And that book has all the details that you need enough for an undergrad. You don't have to go through 2 volumes of Harrison in order to, pass your final year exams or any medicine exam for that matter. So that was something I didn't know when I was in second year or even in my final year. And apart from that, I used to neglect Robbins a lot in my second year. Like, people want to read other books. There are these small books available which you read. But later when I was preparing for my entrances, I realized that Robbins is a mandatory book. Like you need Robbins for, especially like I gave AIIMS entrance separately. Now I believe you have a common entrance INI CET. But till 2 years back, it was different exams. So Robbins is mandatory for, like entrance exams. So if you have read Robbins during your undergrad years, it becomes really helpful. So I had to read a lot of Robbins during my internship days because eventually you have to read that book. Like it's a mandatory book.
So what do you think about doctors who migrate to other countries for their post-graduation? I mean, how is the work culture over here in India, and how do you specifically handle the work pressure?
So after our undergraduate days, like after internship was over, quite a few of my friends went to UK and a few people went to US. So I was in touch. I'm still in touch with my friends who went to UK. So I think I had asked them, why would you want to change and go to another country? Like since you've completed your undergraduation here. So mostly it's the work-life balance. Um, they felt that the work-life balance that you have when you're working in UK, you have something called the NHS, and under which all the hospitals work. So the work-life balance is supposedly better over there. Like I have a friend who's a trainee in medicine, internal medicine. So I had asked him like about his work hours, and he said he works around 48 hours in a week. So 48 hours in a week is something you cannot imagine any medicine resident doing in India. People in India work 65, 70, sometimes even 80 hours in a week. You don't even get Sundays off. So they have proper holidays. Like if they're working for, they have 3 night duties and then they'll get the rest of the week off to recover. So they are not exhausted. But I think here, at least during residency, I'm not sure how it would be later on, like maybe 5 years after residency. But definitely during residency, people are overworked. So work culture wise, if you ask me, mostly I think it's the excessive workload that we deal with over here, the doctor patient ratio, if you think of it. We have too many patients and too few doctors, especially in the government setup. I've seen this in my UG years also in JIPMER. It's like a huge workload. Residents have always been chronically overworked. And it's the same for us over here as well. Like we we cannot escape work. You have to stay here and work. And we don't really have anything called a break exactly. Like you are expected to work. It's not that it they would consider for you that you're overworked, so you should get a day off, or you had a night duty, so you should come late in the morning. It's nothing like that. It's work. If work is there, you are a resident, so you finish the work. And I think that's the main reason why I feel people tend to migrate. It's just for a proper work-life balance. And yeah, a lot of people say that you earn better abroad, so people migrate abroad. I've heard that from a lot of people. But my opinion slightly varies over here. Like, let's say if you're earning more when you're in UK, you're also spending more. The cost of living is much higher in UK than what it is in India, right? So it's not like you're not earning in UK and spending in India. You're earning in UK and spending in UK itself. Yeah. So it's not that you're going to earn a whole lot of money. You can earn money in India also if money is a factor. You have your own hospital or your own lab. But I feel, at least for my friends, whoever has migrated abroad, everybody has this one common thing, that the work-life balance is better there. Like they don't feel overworked or overburdened. They feel healthy. I try to, find some time for myself in between whenever I can. I read books. Like I'm very fond of reading novels.
Why did you choose patho specifically, and what other branches were you interested in? And when did you decide that you wanted to go for patho and nothing else?
So when I was in my undergrad years, I was very fond of pediatrics. Like it is one branch, working with kids is something I completely enjoy. I've spent, and JIPMER has a very amazing pediatrics department. I mean, I would probably call it the best department of JIPMER. The facilities were amazing. So during my final year, I spent a great deal of time there, and I was almost sure that if there's one branch I want, it is pediatrics. And other than that, I liked pathology and some interest in psychiatry and cosmetic dermatology and all. But predominantly, initially, it was pediatrics. So when I was appearing for entrances, I was mainly giving the INI entrances. Like I was not very focused on NEET because I don't know, I had this mindset that since I'd done my UG from an INI, I wanted to do my PG from an INI. Like I had this mindset 2 years back. So I kept on missing pediatrics. Like I gave it for a total of 3 times, and I just, I would get close, but I would just not make it. So then finally I decided, and then COVID came. So that time I had completely decided that I should take up something this year. I don't want to, wait and take the risk because we didn't know what's going to happen after that. So I had a choice between psychiatry and pathology. And I finally chose to go for path because, I thought later on in life, maybe, 10 years down the lane or so, I can think of opening my own establishment, my own lab. And that would give me a freedom of work. Like pathology gives you a very good work-life balance, maybe not during your residency years or immediately after residency, but definitely in the long run, like you can have a good work-life balance. It's not one of those branches where you need to stay awake all night or where you'll be really overburdened all the time. So I wanted a good work-life balance. Like if not pediatrics, then I wanted to go for a branch which would give me a good work-life balance. That's how I thought about pathology because I anyways liked the subject. So when I had an option, and yeah, psychiatry was also another choice, and I really liked the subject. I did think about taking psychiatry. In fact, till my third counseling, I was sitting with a demand draft in hand and wondering if I should shift over. It was just, a fraction of a second decision when I thought, no, since I've joined PATH, I would just continue with pathology. If you're somebody who is a workaholic, I would say, then you can think of medicine because medicine, especially if you're pursuing from India, you need to do MD and then DM is mandatory. Like you, at least in the present scenario, I know a lot of people say you don't need to do DM, but I think if you want to work, especially in big cities, or if you want to really establish yourself, you have to do DM. So it's like 6 years of hard work and 2 entrances. One is your MD and the other is your DM entrance. So if you're prepared for that, then you should go for medicine. And similarly, if you like surgery and you're prepared for 2 levels of entrances, then you can go for surgery. And if you're somebody who prefers a good work-life balance, then you have subjects like radio, dermat, and if you don't want too much clinical exposure, then you have pathology, microbiology, these kind of branches. So choosing a branch is something you realize much later. Like you won't know about it in your first year or second year, or maybe even in your third year. Like I knew I wanted pediatrics only in my final year.
How is a day in your life as a patho resident?
So right now I'm in my final year and I just have like 5 months left to my final MD exams. So we have 3 departments over here under PATH. One is your histopath, then you have hemat, and then you have cyto. So you would be posted in one of these 3 departments. Or you can be posted in autopsy also. Autopsy is a separate section. So if you are in histopath, which is the most hectic of all, like out of the 3. So you in the morning we have a morning lecture, which is around 8:30. It starts between 8 to 8:30 and then goes on for 1 hour. And after that, we have to go to our respective, like if you're in hemat, you go to hemat. If you're in histo, you come to histo. So if you're posted in histo in the morning for around 2-3 hours, we have something called as reporting. It is very similar to rounds in medicine and surgery. So reporting is whatever cases have been submitted to you, like whatever specimens have come the previous day or the day before, they have been all prepared into slides. And you have to report that with whoever is the reporting faculty of that particular week. So that goes on for around 2 to 3 hours. So till lunchtime, you have reporting. And then you have around half an hour, 40 minutes of lunch break. And then you have to come back by 2. And then you go for grossing. So grossing is where you have all your specimens. Like there's something called as large grossing and there's something called as small grossing. Small grossing are all your biopsies, like your gastric biopsies and skin biopsies or any small biopsy that comes. So for large grossing, like we have groups, like one group will do large grossing and one group will do small grossing. So grossing goes on till almost 6 in the evening. Like there's a lot of work. Like I said, The work is a lot and residents are few. So it's like 3 or 4 people or maximum 5 people, and then you have a lot of specimens. So you have to finish it by that day. You cannot keep it pending because your report would get delayed. So after your grossing gets over around 6 to latest by 6:30, you will be submitted cases. So you have to see those cases, and usually it is around like 25, 30 cases per resident. So you have to see those cases, write down the description of all those cases, and that it depends on your speed. Some people take 3 hours to finish all cases, some people take 5 hours. So it depends. Like you start around 6:37, and then whatever time you take, you just finish writing your cases, and then you're done for the day. Like,
How is the life of a UG student different from that of a PG student? And which one is more stressful and hectic?
Um, okay, so UG, the best part about UG, I feel, is that you have definitive hours that you spend in the college. Like you go in the morning at 8 or 8:30 and you get free latest by 5. So after 5, you're just free to live your life. You can study, you can go out, you can do whatever you want. Nobody is going to, come and call you back. But during residency, you're technically on call all the time. You just cannot decide that okay, it's 5 o'clock, so I'm going home right now. So there's nothing like fixed working hours. There's nothing like holiday for us. So that makes residency tiresome if I compare it with the UG life. And also, I think during UG life, since you don't have a lot of responsibilities, you don't have to finish work. You just go for classes, you have your postings, you take history, and you just finish it off. You're basically just sitting in classes and listening to somebody teach. You don't have to diagnose a patient, you don't have to treat a patient, you don't have to sign out a report. So I think the stress level in UG is purely academic. Like you're worried about exams. But during residency, you are worried about exams as well as the day-to-day thing, whatever reports you're writing, whatever patients you're screening, the workload, you have to make sure that work is over, because if it's not, then you will be held responsible for the unfinished work. Like you have to do it no matter how tired you are. So I would definitely say residency is more hectic.
Okay. So I hope you found the video helpful. And if you have anything to ask her, then you can ask your doubts in the comments below. If you really like the video, please hit the like button and do share the video with your friends, and don't forget to subscribe. Thank you so much for watching. Bye.